Welcome to Concussion Talk Podcast. My name is Nick Mercer. I write Concussion Talk, www.concussiontalk.com. This is episode 20, and today I'll be talking to Lauren Ziaks. Lauren is a doctor of physical therapy at a concussion clinic in Park City, Utah. We talk about brain injury and how she treats brain injury as a physical therapist. Okay, I'm talking to Lauren Ziaks now, and I will ask her to introduce herself and talk about where she works.
So my name is Lauren Ziaks. I'm a physical therapist and an athletic trainer. I'm originally from Connecticut, and then I lived in Boston. That's where I went to school at Northeastern. And now I work in Park City, Utah for Wasatch Physical Therapy and Sports Medicine. And I run our concussion clinic here.
Thank you. So where did you work? We talked a bit before the interview. You used to work for the U.S. snowboard and ski team. So that's where you worked previously, or where did you work? What did you do previously? When did you become a physiotherapist?
So I became an athletic trainer in 2009 and a physical therapist in 2012. I worked a lot of football through college, and as a PT student, I worked with football teams, both Division I football, SEC football, and I did a season with an arena football team. And then after I graduated from PT school, I went to the U.S. Skiing and Snowboard Association, and I traveled with half-pipe snowboarding. And I then worked as one of the in-house clinicians, getting everybody ready for the Olympic year for the Sochi Olympics.
Well, okay, so thanks. I didn't ask you, don't have any questions written down for you about the Arena Football League team, but I could have some questions for you about that. But but back to your snowboarding and ski team. When you're with them, did you see many concussions or brain injury?
I had one athlete in particular who did have a concussion while we were getting ready for one of the events. And so it's different. It depends on the event based on whether or not you have total control, or if there's, like for instance, at the X Games, they have their own medical staff. So then you have to sort of work with their medical team, and everyone comes together. We also have a physician that travels with us for every single event. So when there's a physician on staff, they help make that decision. And so everything is done as a team approach. So it's not like you're all on your own making a choice about whether or not an athlete goes back into competition.
So this off script now, but the X Games physiotherapists, how does that work? Are they with your team, one team the whole time, or just with the whole competition the whole time?
So for the X Games, they'll have a medical staff. So they'll have doctors and PTs and different people who work for the actual event. And then the lucky teams, like the U.S. team, for instance, the Canadian team, the Australian team, they travel with their own physical therapist or physiotherapist.
Yeah.
Some of them travel with an athletic trainer. So it just depends on the team. I happen to have been certified in both. Okay. And so you have to follow some of their policies and procedures because they own that event. But then you also have to follow your own country's policy and procedures. And so sometimes those things can be tricky if they have differing policies. So you just have to be able to navigate the waters. And you go through a training session. So when you first get to the X Games, they sit all of the medical people down and they talk about how different scenarios would work. So it runs pretty smoothly once something happens.
That's good.
Mm-hmm.
So when you said you had one athlete who was concussed during the warm up to the games, so what would you like to see? What are the primary concerns you have before an athlete return to competition or even training?
Okay. So I can't say what event that athlete got a concussion at. I just had an athlete that had a concussion. Yeah. I only traveled with that team for about 8 months. There had been other concussions on the team previously, but for my own experience, it was just the one. So we have a whole training, we had a whole return to sport protocol. So not only do we have a physical return to sport, like for the Zurich test, or the Zurich return to sport protocol with the 5 phases. But we also have a return to sport protocol specific to that team's event. So if you're a snowboarder, then there's a specific return to sport protocol for a snowboarder. If you're a speed alpine racer, then they have their own return to sport protocol. So first you go through phases 1 through 5. And once they get into about phase 4, you're allowed to start free skiing.
So what are those? Are they named phases? Are they just phases you judge?
I mean, I want to try to be nice.
Yeah.
No, so you have to go through the regular phases for the Zurich.
Yeah.
But for us, it's more a judgment call. So if someone can do garlands and they have no symptoms, then they're allowed to go and pick up speed. And then they're allowed to hit rails. And then they're allowed to go off a smaller jump. Then they're allowed to go in the pipe. And then you can decide if they can get inverted or if they can rotate. And so you just kind of make a call as the person goes, but there's not a formal, there might be now, but when I was there was not a formal protocol, like day 1 they do this, day 2 they do that kind of thing.
Right. And you are a snowboarder yourself. You snowboard yourself?
I'm not allowed to snowboard anymore.
Okay,
so I'm
well,
not
we'll get into that later, but this question now is, actually it was basically, it's right now, this question now, so you're now a director of a PT, of a physiotherapy clinic, concussion clinic in Utah, right? Mm-hmm. So you just talk about that more and what led to your desire to focus on concussions and speak to your, as interesting and unintentional segue there, your own concussion story.
Do the concussion story or do the?
Well, just you can talk about your concussion story and what led you to work at your clinic you're working at now.
Okay. So when I left the ski team, I went into traditional orthopedic sports medicine. So I was just treating knee pain and shoulder injuries and surgery. And then I had a head injury in 2014. And through that process, I learned a lot more about the treatments out there available to different people. So I had worked more in the sports realm. And so for us, people don't tend to get a lot of the more in-depth therapies. And so after my head injury, I needed speech therapy and occupational therapy and physical therapy. And so I got to learn more about what the good things were and the bad things were that were available to people. Through my own disappointment in the treatment that I received, I decided to become a specialist in concussion management. And so after I got better, I was able to learn from a local person who works at the VA. She's an occupational therapist. And so she helped train me as a vision therapist. And then I went to a few courses over the course of that year while I was doing my intensive training. And then we were able to start our program. And at first, I didn't want it to be its own standalone program. I just wanted to help people in the community. And over time, it has just grown to be the majority of what I see every day in my clinic schedule.
Okay, so actually, you wrote an excellent article about concussion and treating concussions. And I listened to your story on APTA podcast, American Physical Therapy Association podcast, and read the story there as well. So, can you talk about why is it so important that you talk to a neuropsychologist, for example? You talk to several psychologists, several therapists. So we'll start with the neuropsychologist. Why are they so important for you?
So a neuropsychologist is able to do the cognitive testing. So they're able to do a full neuropsych exam. Depending on what you need, it can range from 4 to 8 hours. And what the neuropsychologist is able to do is identify where the deficits are. So is it a visual attention problem? Is it a visual processing problem? Is it an auditory attention problem? An auditory processing problem? So there's lots of different aspects. It's sort of like an impact test, but expanded to the umpteenth degree, if you think about it that way.
Oh, okay.
So it has all of the basics of an impact test. That's sort of where the impact test comes from. I don't work for Impact, so I can't speak for them, but essentially that's where impact comes from. That's like a 30-minute test. But if you go to a true neuropsychologist, they're able to do this really in-depth testing and figure out exactly what's going on inside your brain. And so for me, someone who is struggling with time management and aphasia and attention problems, it was really important because he was able to identify what types of therapies would be very helpful for me in my recovery.
Yeah, actually, I'm working with a speech pathologist again now. I don't know, it never had aphasia, but it had dysarthria was one of the ones they spoke about for me. And but speaking of speech, you also had a speech language pathologist. And what did they do that was so important?
So I saw 2 different types of speech language pathologists. I saw one in the very beginning that worked with swallowing disorders, and I had a breathing disorder. I was only using my accessory muscles, my upper muscles, to breathe. And that was causing my vocal cords to slam shut when I was trying to take a breath in. That obviously would cause dizziness and difficulty exercising, things like that. And I had a really bad, I don't actually know what the name is because the speech language pathologist did the therapy for me, but basically a really bad gag reflex. So if even clothing touched the front of my throat, I would get really sick. And so I had to do a bunch of therapy to help with that. And then after my neuropsychology appointment, they tried to put me on Ritalin, and that went very poorly.
Yes.
So they decided to send me to a different type of speech language pathologist who does cognitive therapy. And so we did traditional cognitive therapy instead of using medication to help me with my processing issues and my attention issues.
Okay, and we'll get into your next therapist in a second, but because you said you had the problems like even just putting on clothes and just being sick. Basically, sounds like just around that, like breathing and being sick. So you had about how long do you think after your that last head injury do you think you were starting to feel better?
Or starting to feel
actually
around
don't.
What?
Yeah. Okay. Sorry.
Okay. Around the 1 year mark, I started to finally feel better. That was around when I finally found some really good providers. So I wasted, unfortunately, a lot of time early on with therapies that weren't very effective. So once I met my friend that worked at the VA and I started in with some of the cognitive therapy with the speech therapist, things started to really turn around for me. And then, there will always be deficits. Fatigue is always going to be an issue for some of us who've had either more severe injuries or have had a lot of injuries. And so for some people, and I'm one of them, you have to practice energy conservation techniques for life. And I finally come to terms with that. I had a bad experience with some baseline testing in a really busy environment a couple weeks ago. And I got really upset about it. And I called my friend, my OT friend, and she says to me, well, when are you going to realize you have to practice energy conservation techniques? And I said, no, I don't have to do that. So I got a nice little lecture, and she was right and I was wrong, and life has been a little easier since I left my little land of denial.
So speaking of OTs, why are they so important? Aside from obviously you save energy.
OTs can do a lot of different things. For me personally, I needed the vision therapy, which is traditionally done by an OT. There are now more physical therapists getting involved with vision therapy. And they can help with ADL, so activities of daily living. OTs can help with people who have neglect. So I have a patient who's worked with an OT specifically for that reason. Neglect is when you basically don't acknowledge half of your visual field. So for this sweet lady, she was trying to take down her Christmas garland, and when she came back in the room later, she realized that she had missed 2-foot sections across the whole room,
really?
Just based on where she was looking at that time.
Yeah.
They also can work with, people will have issues with different textured flooring. So if transitioning from carpet to hardwood, and I'm sure PTs can work on this too. I happen to not do that. I refer to the OT because it makes life easy that way. But for those people, OT can really make a difference in their life. Some people need OT because they have to have adaptive equipment. So unfortunately for some people, their brain injury is so significant that perhaps they have tremors and they can't utilize their dominant hand anymore, or they can't do fine motor tasks, or they can't navigate pouring a kettle or a heavy object over into another pot. And so OTs are very good at adaptive equipment and teaching people compensatory strategies.
Excellent. Well, yeah, I found that too, and I was doing my occupational therapy. I had to actually to learn how to just find a new kind of strategies so I could get around the kitchen and get around the bathroom and house and stuff. And yeah, so they're definitely invaluable. Now, if somebody walks into your clinic, now I'll try to say this correctly, the Wasatch Physical Therapy, Wasatch Sports Medicine and Physical Therapy, or Physical Therapy and Sports Medicine, is that what it is?
Physical Therapy and Sports Medicine.
Okay, Wasatch Physical Therapy and Sports Medicine Clinic, and says I have a concussion, and you have verified you have a doctor. They have a doctor to know they have a concussion. So, what steps? Just go through how you would treat this person X who comes in with a concussion.
Okay, so there's 2 different kinds of patients that come in for me. They can be an acute patient or an early patient. So for those people, we'll do a general exam. So we'll look at head and neck. If there's any suspect of vertigo or the type of dizziness where the room spins, I'll assess them for their vertigo and I'll treat it if necessary. We do a lot of education. So what we know now is that early management makes all the difference. So if someone comes in and they're really lit up, they've got a lot of symptoms, sometimes just doing the right thing, teaching them about avoiding screens, teaching them about the right supplements, teaching them how to pace themselves, how to start early cardiovascular exercise, so 20 to 40 minutes a day at a 5 out of 10 effort or less. Those kind of things can really make a difference in how long it takes someone to recover. We'll do manual therapy to their neck to treat headaches and neck pain. And we also have a cranial sacral specialist on staff, and so she'll do cranial sacral therapy to the patient. And then I start everyone on neck stabilization exercises because of the research that shows that increasing your neck strength helps reduce future concussions, and it also helps with neck pain. If someone comes in and they're more than 3 weeks out and they're referred for a vision eval, then what I'll do is, if necessary, we'll treat their neck and all of that, but usually they're already plugged in with somebody. But I'll do an ocular motor screening exam, and I'll also do a vestibular exam with that patient. And then I start them right away on a daily home program. So if someone comes in for vision and vestibular therapy, usually it's for both. I think that's one of the key pieces for concussion management, is that if you just treat the eyes or you just treat the ears, you're not treating the whole problem because they work together. So we add in vestibular after about 2 to 3 weeks, depending on the person. They generally don't tolerate vestibular exercises very well in the beginning. And then they do a daily home exercise program of approximately 30 minutes, and they see me once a week for about 4 to 6 weeks. Then they see me every other week for about 1 to 2 months, and then I discharge them with about a 4 to 6 week home program. And, it depends on the patient, but that's a pretty typical mild to moderate concussion that does well, and that's about the schedule that we see them on.
Oh, okay, thank you. So actually, I've a totally off-script question here for you. So say if someone came into your clinic and had a brain injury, say 13 years ago, and a severe brain injury 13 years ago, and has had double vision since then, what would you do for this hypothetical person?
Hypothetical person, I would do my full oculomotor screen. So the research is showing that a vision exam and vision therapy can help upwards of 15 years out. There might be even newer research since I read that last year. I've had patients who are 20 years out that have had some benefit from therapy. So the earliest I'll start is 3 weeks, but I'll start as late as they walk through the door. If someone has double vision, there's a whole host of different reasons why that could be. It could be a cranial nerve 6 palsy. It could be.
And let's say that person has had surgery on the cranial 6 nerve.
So if that person's had surgery, they might be a little above my pay grade, but I would do my best for that person. I have an eye doctor that's about an hour away from us, but he comes up every other week now because we work so closely with him. And I would send them there. So I would do my screen, and I would do the best. I would probably start with monocular exercises or one-eyed exercises just because of the double vision. But I would refer them immediately to my eye doctor, and he would probably prescribe a prism lens, I would think. Patch therapy is really old school. Some people don't have any options, so they might have to do a transparent patch. But that, again, is not what I work with. Those people are not in my scope of practice. I work generally with the higher level TBIs. I will try my best if someone has no other option, but I'm generally very honest with them that it's not in my area to work with patching or anything like that.
Okay.
From what I've heard from my friend that works at the VA, they actually do very well with prism lenses and patch prism lenses. You just have to have a therapist who knows what they're doing, because you can make someone worse if you utilize those techniques and you don't know what you're doing.
Okay. Well, take that into consideration because I'm kind of past all that. But
there's always something you can do for people.
Exactly.
So.
Yes. But yes. So thank you so much for. Do you have any questions you'd like to ask this hypothetical person, being me? It's not really hypothetical. And do you have any questions? Any questions you'd like to ask? Do you have for me at all, or if not, then.
Well, what kind of questions can I like?
You can ask whatever you want. I mean,
so why?
There's just I'm just wondering if you'd like to ask any questions, but if you have nothing to ask, then don't worry about it.
Well, why did you start the podcast? Is it because of your head injury?
Yeah, yes, it is. Yes, I am this hypothetical person who's had double vision since a severe brain injury in '03.
So how do you function with double vision? Because for my patients, it's quite crippling for them.
Yeah, well, it was at first. I mean, I've read I had a patch for a while, and
Yeah.
I read even I think yeah, I read it with the patch on. I would only read it the first couple of years or a year. I guess I would really only read with the patch on, which always
Mm-hmm.
made it slower and made it more tiring. But I got through it. I always read a lot, so it was kind of second nature to read. So kind of got through that. But and I tried prison lenses as well, and that didn't happen. That didn't work that well at all. So I still have double vision. I've had three surgeries to fix it, and
Wow.
has not hasn't worked. Hasn't really worked. It was good. I'm glad I did them, but it's not. It was a good effort, but
It was a
there
good
it is.
effort.
It was a good effort, but there it is. Didn't happen for me. So yeah. So I started this podcast, my blog in 2010, and this podcast in 2015 because I just wanted to talk about brain drain and what can be done about it. So
Yeah, well, I think it's great. I mean, people need to know about the different types of treatment that are out there for them,
exactly.
especially, it's a little bit, I don't know how to say that the right way, but it's almost easier to fight for treatment for people who have more obvious deficits, but in the concussed population, there's so many people with attention problems or difficulty in
Yeah.
school that develop depression and anxiety and
Yeah.
maybe don't live up to their full potential. And it's so hard still, even after a year and a half of being in our community, to explain to people why the therapy is important, to
Yeah.
teach doctors. Or when I was first trying to educate doctors about the program, I had one say, concussions get better in about 6 months to a year. Why would I send them to therapy? And I said, well, rotator cuff tendonitis gets better in about 6 months to a year. Why do you send them to therapy? and
There's
he,
no answer, right?
and he says, that's a fair point. I said, if we can fix them in, I said, if we can fix them in 2 to 6 months, wouldn't that be better than 6 months to a year? And he says, yeah, I guess that's a good point. He sent me a couple patients after that, but
Oh, nice. Well, open minds at least, but all kinds of at least. So how long have you been at this at Wasatch Clinic?
I've been here. It'll be 3 years in November, but the program's been around for a year and a half.
Okay,
And
the
it's just been
concussion,
growing.
the
Yeah,
concussion
just the
program.
concussion program has been around for a year and a half, and the outcomes have been incredible. In the beginning, I wasn't really sure how many people I'd be able to help, but even if you can't get somebody all the way there and you have to refer them elsewhere, and that happens sometimes with people, the amount of change that you can make in someone's life just by taking away vertigo or by making them less sick in the car or letting them be more efficient when they try to read and study at school. I mean, the outcomes sort of speak for themselves when I talk to doctors about the value of the treatment, but for the patients, it's really rewarding. It makes you feel really good when you're able to discharge someone and they feel so much better. I recently had a patient who was 4 years out from her head injury, and her doctor told her there was nothing they could do. That was it. She was just going to live like that forever. She was taking 2 classes a semester in college, so it would take her
Yeah,
20 years to graduate.
yeah,
Um, and we did some vision therapy. She had some ocular motor deficits, and she had a binocular vision disorder, so the way her eyes work together. And after about 4 months, we discharged her, and she's taking 8 credit hours this semester, and she's hoping to go back full time next year. So, I
nice.
mean,
That's
that's a
excellent.
huge change for that person's
Yeah,
quality of life.
that's excellent though. So yeah,
Hmm.
so I mean, next time in Utah, which will be the first time I've ever been to Utah. If I'm ever in Utah, I will definitely stop by. If I'm in Utah and near Park City, I will
Yeah, absolutely.
stop by a clinic.
Anytime.
But I honestly don't know when that would happen. But yeah, but I mean, it definitely sounds like something that's worth if you're near the area, it's something worth looking at. So
Mhm.
thank you so much, Lauren.
You're so welcome. Thank you for the opportunity. I appreciate it.
Well, thank you. Thank you again to Lauren for a great conversation. You can check her out on Twitter at LZ Concussion. You can check out her concussion clinic at www.wasatchsportsmedicine.com. Thank you all for listening. Until next time. The music at the beginning of this podcast is by Ben Sound. www.bensound.com.